Okay, so I think we'll get started. Good afternoon and welcome everyone to our today's scheduled webinar titled Beyond Adherence, Empowering Individuals to Make Informed Decisions About Medication with our presenter, Dr. Anthony Salerno. Before we get started, we just wanted to do some quick housekeeping. Everyone is currently muted, so please use your chat box to submit any questions, any comments at any point in time. If you're having any technical issues, make sure you chat to the host so we can address any of those issues or concerns. This will be a bit of an interactive kind of webinar. There'll be opportunities to answer some polls, to answer some questions that come up as part of kind of discussion. So we encourage strongly that everybody participate as much as possible so we can make it an engaging experience for all. As you can see, the webinar is being recorded. The slides, the recording, and there will be a handout as well that we'll review. All those materials will be available on the ctacny.org website within a couple of days. This webinar is eligible for one CE, specifically for social workers and LMHCs. If you're interested in getting that CE, make sure you're registered under your own name. Make sure you're not using a shared link or somebody else's link. So make sure your name is inputted as the participant, and so you can get credit for attending. And you have to attend the majority of the webinar. Additional information will be provided to you at the end of the presentation or emailed out to you in terms of how to access that CE. Additionally, at the end of the webinar, we'll be sharing a feedback survey, and we strongly encourage you to complete that so we can continue to improve our offerings. And we do look at that feedback. So please share your thoughts if you're interested in more content related to this webinar or any other trainings. So without further ado, I'll pass it over to Dr. Tony Salerno.
Thanks so much. Thanks so much, Lydia. Excuse me. Let me control these slides. Okay, very good. So my name is Tony Salerno, and I'm with McSilver. I'm the Innovation Implementation Officer. I'm a psychologist by training, but I've been in the field for a long time. And this issue of medication, I think, is a really critically important one. So I really am gratified that there were so many folks who were interested in this, because I think it's a critically important way in which we engage folks, and so that they can be empowered to make really decisions about the role of medication in their own recovery and overall health and well-being. So we're going to really look at the importance of using medication in a safe and effective manner, why safe and effective use is such a common challenge among so many folks. And this really applies way beyond just folks who are using medication to address substance use or mental health issues, but really just a common challenge in the role of pharmacology, really, in the lives of really all of us. That we're all playing a role in this issue as well. How to engage folks in making informed decisions, and that's really intentional. You know, it's a little bit different than what dominated so much of our thinking around medication use, which is, you know, how do you get people to take it, and to take it in a way that's prescribed. And it's a different mindset when your goal is just get people to do something, even if folks have a lot of concerns about the use of medication, and some strategies that are really thoughtful, respectful strategies to engage folks in making informed decisions. So one of the reasons why this is so important to me, before we get into the poll question, is I think I've done this pretty well with a number of my clients over the years. And I also think I did it not so well. And so I hope to be able to share with you approaches that are unlikely to be helpful or actually compromise the relationship, and those approaches that can be very supportive of both the relationship you have, as well as supporting the individual in making decisions that really work for them. So here are some of the poll questions. We have a number of them, just to get a sense of what your experience is. So what percentage of your clients would you say, if you just take a guess, right, that are likely not taking medication as prescribed, in a way that likely to compromise their recovery? So I know it's just a guess. Again, I just want to get a sense of how people are thinking about this out there, and what your best guess is about the number of the folks you work with who are probably not taking medication in a way that's likely to be helpful and useful for them in the long run. Okay, so we're just going to give that a moment. And then Connor, who is helping us with this whole process. So it's all over the place, right? So less than 10%. So it sounds like the majority seems to be towards the over 25% of folks. So it's a very significant number. You have some doubts about whether or not a treatment like medication is likely to play a role in that person's recovery process. Thank you so much for that. In a way, you're indicating exactly why this topic is so incredibly important. The next poll question. Oh no, this is a. I'm sorry. Wait. Okay. Okay. Now we want to go to actually a chat. So we're using this term non-adherence or non-compliance versus shared decision making, person-centeredness, and empowerment. How does the language of non-adherence and non-compliance differ from a person-centered approach to concept or attitudes or language? So just give that a little bit of thought, because we intentionally stayed away from the notion of non-adherence, non-compliance, and we went towards the concepts and principles of shared decision making, person-centeredness, and empowerment. Why do we do that? What's the difference in the language when you approach things in this way? What are your thoughts? We just get folks, it's punitive, complaints, the impression of someone else is being controlled. Thank you, Marisa. Adherence lets a person own their own decisions, own their recovery, own the formula for success. Formula is top down rather than shared, collaborative. Thank you, Angela. It's a kind of negative kind of view, right? A person is like just not doing what they're supposed to be doing. Not the around being blamed, the idea of blaming individuals. That's exactly right. Thank you for Marion. Okay, you guys really you hit it on the head. So it's really helpful to know that this kind of aligns with some of your own thinking about it. And you really want to work with and not against. Thanks. Yeah, have them coming in. That's exactly the issue. So it looks like that you appreciate the fact that the language that we use expresses a certain attitude that we bring, and it can influence the way that we work. I certainly, and I have to just be very frank with you, a lot of my initial work when people coming out of state hospitals back in the 80s, as I said, I've been around a long time. I must admit, and this was not just me, but I would say the entire field, we often found ourselves, trying to how much pressure we can bring, how much we can convince, persuade, cajole, right? Sometimes subtly coerce, right, individuals into engaging in treatment, including medication. And it wasn't coming from a bad place of control. It was coming from a scared place, scared about what the potential outcome was for individuals who were not using medication in a safe way or an effective way to manage some very serious symptoms associated with some serious mental health conditions. And this goal of ensuring that folks didn't bounce back in the hospital, we were really dominated by that. And it created that kinds of things that you guys mentioned is not good, which is became more of a, could feel more punitive for the clients, right? It could be like control and pressure. And that was, and in the long run, it also didn't work. That's why it's really important. So thanks so much for what you're bringing is, I think, a much more sensitive, a much more person-oriented approach to this. Okay, I have another poll question for you. How confident are you that you know which of your clients are not using medication? So can you tell, are you able to detect either through their letting you know or through your own observations, but just try to get a sense of, are you confident that you can even open up a conversation with someone that you believe is maybe unlikely to be using medication in a way that's really going to work for them? Just give that a moment or two. Okay, Connor, when you get a chance, great. Again, it's interesting. We're kind of showing a great variation. in your responses, which is a really good thing. That means folks are being really honest because it does vary a great deal. So some folks saying, look, I kind of know, I feel confident. Others are saying, no, a little bit, I'm not sure. I go back, I'm not quite sure what to attribute, what I'm observing. I'm not quite sure if a person's telling me the truth. They can feel very reluctant to share. They may feel like they don't have a safe space to be very honest about their role, their use of medication. So that's really very helpful that it varies. My goal is to increase your confidence in being able to engage somebody in a very thoughtful and respectful way of approaching this issue of medication. Okay, let's go to the next slide. And yeah, I notice folks just commenting. Please have your comments, questions, come in as you see, as you're reacting to whatever I'm sharing with you. Here's another poll question. How often do you discuss or check in with your clients about medication, this aspect of their treatment and service plan? Do you find yourself really, look, I very frequently touch base, I check in frequently, some of the time, occasionally. Well, honestly, I kind of leave that to the prescriber. I don't really get into these issues that often. So let's see what folks have to say about it. Okay, so great. It sounds like almost 75%. This is a topic that you do raise with your clients, and some have just some of the time. This is really important because what I hope to do with this information I'll share with you is how to make those conversations, how to make those conversations as useful and as helpful as possible. Thank you so much for sharing that. And the last poll question in this section, how challenging is it to engage clients in making decisions about medication in a way that works for the person? Is this something that, in your experience, folks generally feel pretty comfortable talking to you about, the use of medication, the issues, concerns they have about it? Or do you say it's like really very challenging to have that kind of open and honest conversation about the role of medication? Is it very challenging to have that? Challenging, somewhat, or not too challenging? Best thing is piece of cake. Denise is kind of saying their behavior changes regardless of them saying. So you're really looking at observation. So some of it has to do with the person is willing to share with you. So there's a good number of saying is, it's somewhat challenging at times. Others are like it's pretty challenging, and a few that's very challenging, and others feel it's pretty comfortable. In my work with my clients, again, we see a great deal of variation, which is, I think, pretty important as well. Thank you. Okay, so why focus on this issue of medication? And when I was looking in the literature in this area, I have to tell you, it was like really eye-opening. Not using medication, as prescribed. And we're not just, again, we want to get away from the idea that it's just somebody doing something because we tell folks to do it. There are things that we can do in the way we've developed our system of how do we engage, inform, involve folks that can also be a barrier to folks using medication in a way that's most likely to be helpful to them. So this isn't about, the clients are not, kind of going along and not being responsible, but we have to also take a look at how we've developed a certain system around how we prescribe, engage, inform, involve people in making decisions. So I just think that that's important to emphasize. But when you look at the data, some consider this really a pretty serious invisible epidemic. The rates of non-adherence, right? Folks not seeming to, maybe filling medication, but not using it, not filling medication. So people with bipolar sort of difficulties, average rate of non-adherence is between 40 and 57%. That's a lot. That means around half of folks for whom a medication is being prescribed for a bipolar related symptoms are not taking medication in a way that's likely to be really helpful to them. For major depression, anxiety, 55%. And we know that there's just all these studies For folks for whom medication is likely to be a benefit, but for whatever the reasons are, and there can be many reasons, including how our system, right, has not really created the kind of like safe zone and a process that can be really very helpful. So we can be much more supportive of individuals, both in making their decision, and if they decide this is going to be part of their formula for their recovery, how do we ensure that we make it as supportive and as easy to do as possible? So the poor client outcomes that has been studies, you could predicted this as well, right? Relapse risk, delays in remission, increased risk for harm through suicide, premature death. I mean, it's a really serious issue, and that's why we want to really look at it and address it, today. Negative outcomes also include higher rates of relapse, right? More emergency department use, higher rates of hospitalization, longer hospital stays, higher rates of involuntary retention. I have seen this because I work with individuals who are coming out of state psychiatric hospitals during deinstitutionalization. And I can tell you that this is my lived experience of it as well. The folks that I worked with, and for whatever the reasons were, who were not taking medication, as prescribed, or sometimes they were being prescribed the wrong medication, or there was ways of not knowing exactly what people were actually doing and making a lot of assumptions about things that then led to poor prescribing kind of practices. I'll get into that a little bit later, but this is something I have seen, and there are some individual persons that I could think of, folks that were doing pretty well when they were pretty stabilized and doing pretty well on medication, and if for whatever reason decided they didn't want to do it any longer. And I saw some of the consequences of that. I think we could have been much more helpful to those folks. I don't think we were as supportive. I don't think we created the kind of safe zone. I don't think we really provided the kind of education and information that I think could have been much more helpful so that the individuals could have made a more informed decision about the role of medication. Okay, so pitfalls. When you don't know, and some of you are saying, sometimes I feel confident, sometimes I don't. I'm not quite sure why the person might not be self-disclosing and being honest, right? Maybe the person doesn't trust us. Maybe they're concerned about our reaction to a person saying, look, I've decided that I'm not, medication isn't really right for me, and I'm going to try to manage this on my own. If they're really concerned about what our reaction would be to it. Sometimes they're getting messages from others about not taking medication. I mean, there's a very many complicating factors here. But when a prescriber doesn't have a good sense of the person's use of medication, what can happen is that you can add more medication or increase the dosage, right? Or you can misattribute the factors associated with relapse, right? The illness progression and relapse. So you can make a lot of mistakes. You can change medication because, well, I guess this is not working. The reality is the person is not using it and not taking it at a level that you can even determine whether it would be of benefit. So not having a clear understanding, not creating that relationship where there's a great deal of trust and honesty about the use of medication can lead prescribers to make decisions with faulty assumptions. So understanding these factors, right, around the underuse, overuse, or misuse. So in your experience, what do you think are the most common reasons why a person chooses, decides, or just feels compelled not to take medications as prescribed? Let's get a sense of what you guys think about that. The side effects and stigma, want to do it on my own. They know how difficult with costs, right? So there's some practical issues. They don't know how, right? There's a skill issue involved. They don't know drowsiness, denial of the person may not appreciate, right? What kind of challenges they may have, little insight, don't like the way it makes them feel, side effects, forgetful. Some just forget, right? Think they don't need it. So you're bringing up a lot of side effects, feeling better off meds, right? Not seeing a connection between medication and a benefit. Okay, kind of, there's a lot of ambivalence. Folks have a lot of ambivalence. I take medication. Maybe many of you take medication. I'm often ambivalent about it, wondering if it's really, with some of the side effects, some of the potential problems. Some say, look, they just don't experience the benefit and feel like it's really working, right? And then you also have to begin to determine, well, yes, at times maybe we've not hit the right kind of medication, or we're not at the right dosage, or not the right combination. So those are issues. Insurance concerns, illicit drugs replace legal meds. Yeah, a person might say, you know, it works a little bit better when I want to like calm down my anxiety, or when I'm feeling stressed out, or when I want to get to sleep, or whatever it might be. Yeah, so you guys have got it. You know, I have to say, you really have some good insight into that. So we can see that there's a lot of potential reasons. And I want to share with you, because this has been studied a lot. And some of the things that we have found, what the science tells us, and this is through use of a lot of structured assessments and medication scales and drug attitude scales, and these medication adherence rating scale. And there's a bunch of other scales. So with a lot of these particular scales, right, these are, there's a lot of ways of trying to assess it, right? Sometimes you just ask the person, and then there are some structured scales. So what I just showed you was a whole bunch of scales that have been used to try to identify what are some of those reasons, right? From attitudinal to some practical barriers that a person might experience. So this is what the research sort of suggests for us, particularly around individuals with suffering from a psychotic kind of like problem, the symptoms associated with the diagnosis of schizophrenia. Stigma was big, and you guys hit on that. People's the way in which people can see medication as an indicator of deficiency, of disorder, right? Of deficit. Of some folks can feel very shameful about it. Different cultures and folks from different backgrounds. The attitudes towards medication, particularly for mental health, can range from being like very supportive to viewing it really as harmful. I remember working with a program, multiple family groups, and it was with the Asian population, mostly Chinese population. And it was one of the insights we gained from this is many felt that the medications, the psychotropic medications, were described as being too hot. What they meant is too strong, not really calming, not having balance. So there was like a lot of attitudes and beliefs from family members that plays a role in the likelihood of an individual taking medication or being open and sharing that information with whoever the prescriber and other helpers that they have. So stigma is big. So that requires a conversation if stigma is one of the barriers. Adverse drug reactions around side effects and things like that. One of the other barriers is if a person was homeless, didn't, that their life, basically day-to-day living, was very unstable, right? They were in different places at different times. Others is where the role of substances, where people were also saying, well, I happen to like using sort of illicit stuff that's on the streets, and maybe that's not a good combination with this stuff the psychiatrist and nurse practitioner is prescribing for me. So sometimes that's like an issue that folks have. Sometimes people get the message in trying to substance use recovery is to stay away from all medications that have an effect on your emotional or your intellectual or mental functioning. So those attitudes can play a role. Memory problems, just remembering, lack of support around this, afraid of medication. Someone's just terrified of it. Denial of illness, we have to use the term denial, I think, very cautiously. Sometimes the inability or difficulty in assessing your own and monitoring your own behavior and having insight into struggles that you're having can be an actual symptom of the disorder itself. I think that's an important piece. It isn't like I'm pretending I just want to deny it as a psychological avoidance, but oftentimes it's a feature of the illness itself. And I think that that's important to recognize. Lack of trust in the provider is also important. Yes, Linda, the anosognosia, I'm glad you brought that up. It's just a term that describes neurological disorder, but has been often used to try to explain why it is that individuals who've been in the hospital 20 times, have had many functional problems, haven't worked in 20 years, been arrested by the police, has been dragged into psychiatric hospital, all of that. And you say, well, of course the person must realize that they have a problem, and still the person is not, it doesn't have that insight into making the connection between all these things that have happened in their lives, that has been disruptive in their lives, and attributing into an emotional difficulty or mental health problem. And we're beginning to appreciate how lack of insight can be a feature of serious mental illness. And then difficulty with the regimen. That's the idea of, I'm taking 8 medications or 12. And some folks are taking so many medications and just trying to keep track of them, figuring out which one does what, even remembering what the purpose is, or how do I even know this is helping me, and all that kind of like stuff. So these are some of the reported barriers, and they're not so dissimilar for other difficulties like as well. Okay, so okay. So Dr. Salerno also was, and I was going through a lot of these inventories and surveys and, ways of trying to assess people's beliefs, views, attitudes about medication. I thought it might be useful to kind of like think about extracting those items and identifying and reinforcing those common questions that are often part of some of these, and to kind of put it together in, I hope, a language that is a little easy to understand. And so I call this Dr. Salerno's not so famous brief medication attitudes and beliefs questionnaire. And here are some of the concerns. And here's my challenge to all of you. Did I miss something? So as I go through this and share this with you, because this could be perhaps useful in your sharing with others, or exploring what are some of the concerns and beliefs that folks have. So one of is, I don't feel the medication is helping me. Just simply stating that. Side effects are just too uncomfortable for me. I find it just difficult to remember taking the meds. I don't really get why I need this medication. It's like, I don't really see the connection between any positive benefit, and why should I take it then? I have too many medications. I get confused, overwhelmed. I don't really think I need the medication. I'm not sure the person prescribing the medication understands my concerns. I'd rather not talk to him or her. That's like an important issue, right? If a person says, they just tell me I got to take the medication. I said, I don't like to do it. They just tell me, well, you have to take it, right? And it kind of pisses me off, right? That's a really important issue for a person to be able to identify that. Then you can intervene in some way, right? I don't think I should rely on it. This is the idea of feeling it's a weakness to be taking medication. I should be able to manage my life on my own. Why should I depend on this thing, right? My family or friends don't really want me to take medication. That's really important. Don't believe that family and others, because they may have some attitudes about the medication, and they may be communicating clearly, that I don't think that you should try to do it on your own like your brother does, or your sister, or your cousin, or how we do, and part of it is to try to minimize and try to, minimize the acceptance that the person may have a serious mental health issue that needs to be addressed in some way, for whatever the reason might be. Stigma again, or the belief that this is going to be a lifelong sentence, so that it's going to disrupt your life for like forever, and you don't want that to happen. It could be a lot of issues. Okay. I just feel bad about it. I just feel bad. Instead of saying I have stigma, it's embarrassing. I just feel bad about it. I can't really afford the medic. I mean, driving is crazy. This copay thing and stuff like that. Forget it. It's just like, I don't think it's worth it. I think it's doing more harm than good. I get really fuzzy sometimes. I get also these kind of, I don't know, my fingers and my arm kind of like shakes a little bit sometimes. I don't like that. And then I want to tell you some of the other things that happened to me. It's very personal, but I don't like it. And then maybe there's some other concerns that are not on the list. Anything that I missed here that you think, Dr. Salerno, even though it's not so famous, I think you missed some stuff that you should add. Cultural beliefs. Okay, Beatrice, I think maybe you're absolutely right. I think we can get into more of the cultural beliefs. I have just a general kind of notion, but maybe it's worth being more specific, so that you have a chance to explore, well, what are some of the beliefs based upon your own upbringing or your family background or your culture. So thank you for that. That's really helpful. Anything else that I might have missed?
Danica said, don't want to get addicted to it.
That notion of I don't want to find myself having to take this all the time. So that's a real thank you for that, because a person might say, look, the idea of being on medication for the rest of my life is just unacceptable to me. Actually, people do that around a lot of medical health conditions, that where they're prescribed. Say, look, you're going to have to be on this thing for the rest of your life. I have that with cholesterol medication, right? So you start as like, yeah, this is it. I got to tell you, I had some really strong feelings about taking anything that I'm going to be taking for like 50 years, right? So I understand it. So those are two really good things. So maybe this is going to, at some point, maybe this won't be Dr. Salerno's not so famous, but with all of your help, it may end up to be Dr. Salerno's famous brief medication attitudes and beliefs questionnaire. So I would appreciate that. Okay. Lydia and Connor, really, if you see some other comments coming in, please feel free to just interrupt me a little bit and share that. Oh, I've heard from Glenn, it changes my personality, or I just don't feel like myself. That is very, very common. Thank you, Glenn, for bringing that up. And I think that could be sort of another item, is that the person is more than just side effects, but it's the kind of side effects where I don't feel myself. Thank you for that. That's a really good insight, because that's a much more um, critically important change that the person's experiencing, which is much more disturbing and distressing than, oh, what I get is sometimes I get constipation, or what happens, I get sometimes dry mouth, which can be irritating, but that doesn't change your personality. But if a person sees, like, I just don't feel like myself, that's a very serious thing that needs to be taken very seriously. Thank you for that suggestion as well. So I think we have 3 additional topics that we could add to my not so famous beliefs and questionnaire.
And I think we have a few others that kind of keep popping
Sure.
up. One concrete one was, I don't like taking pills.
Right.
And so this person then said, well, we can find an alternative. Let's do liquid. And that worked. Right. So sometimes it's a more, concrete kind of issue as well.
Excellent comment, because sometimes that's part of what a prescriber and how we can be helpful is to choose a method or a method of medication, which could be either liquid, pills. Sometimes people are more comfortable with an injectable medication. For if someone is eligible for an injectable medication, so they don't have to really think about it too much, right? You just make a medication every 3 weeks, every month, or whatever the regimen might be. So there are different, approaches to administration. Very good point. Thank you so much for that. So here is, again, this just sort of explains that the more you have to take medication, right? The more complex the regimen, the less frequency of use. Makes sense, right? So how can we help? So first of all, the question is, whose business is this, right? Is it just a prescriber's business? Do you play a role? Peer specialists, do they play a role? Practitioners, recovery coaches, family members, members of the person's social network, pharmacists. So I think what I just want to raise here, it isn't like there's an answer to this, but I think what I'm sort of suggesting is that what we don't do is just let it be the job of the prescriber. Prescribers oftentimes have limited time that they actually spend with clients, that we can all contribute. It takes a supportive group, I think, to be as helpful to individuals, so that medication plays a role that's both safe, makes sense, is effective, and can contribute to that person's overall health and well-being. So I just want to make that point. If in some, because some folks do kind of avoid that space and kind of think of it, well, that's the prescriber's kind of like zone. That's their expertise. I don't have expertise in medication. But this really suggests that the expertise is not about medication. The expertise is on shared decision-making. That's the expertise that you bring. Identifying challenges, problem solving, right? Those are the skills that all helpers ought to have as sort of a core skill and competency is helping people to identify problems, to be able to generate potential solutions, to understand the factors that are contributing to a problem, to think of alternatives, to explore consequences. Those are generic skills. You don't have to know anything about pharmacology to assist a person in making those decisions. Consider checking in about medication as part of routine, ongoing assessment. Those of you who feel comfortable with that, and again, something that is not expected to exceed your own competency, but this is how we as a system can be more helpful, is that we don't just say it's one person's responsibility, that all helpers can see that that is an important decision point for anyone that we're working with, and that we may have established a relationship where people can trust us and honestly share with us their concerns and worries, and that we're in a position to be supportive to them. So acknowledge that, ask about the benefits, acknowledge that taking medication every day, it can be a hassle. So acknowledge everybody on medication misses taking it sometimes. It isn't like everybody takes it every single time. It isn't like, oh, you missed it, you're really screwing up. But just kind of acknowledging that that this is a very common thing, that this isn't somehow exclusive to people who are taking medication for mental health issues. Instead of asking, did you miss any dose? You can ask, how many doses have you missed? Oh, it's really kind of normalizing and say, look, so when you think about it, it's kind of hard to keep on top of all of this. How many times do you figure you kind of miss out on taking medication, just kind of forget, or you just like, not don't want to be bothered, over the course. So it isn't like this is so unusual, right? Ask if they felt or acted different on days when they missed the medication. You see if a person has any insight into really determining, right, having an experience of where the benefit is, because that's a really important issue around benefit. And without judgment, asking what their concerns are about medications. Okay. There's practical issues. Again, these are just some areas that you might want to explore, from the insurance to how do you get to the pharmacy, how many different meds are in total, how many times a day do you take. So this is kind of like, sometimes it's just like a real hassle to kind of take it. I have to getting to the pharmacy is a big pain in the neck. It's I have to take it like 3 times a day. I forget about the morning. I'm doing other things. Do you have a planner? Do you just have 6 different bottles that you say that so it could be some very practical kinds of issues that you may not even know is part of the challenges that are influences the use of medication in a way that's likely to be helpful, safe, and effective for the person. So helpful strategies is selecting and ordering medication. Really, that's looking at target symptoms, trying to minimize the side effects. Prescribe may consider long-acting medications, right? That should be explored. Maybe it really works better for an individual around injectable medication. Simplifying the medication regimen, thinking about, whether there's medication that can have the same sort of an effect, but only needs to be taken one time, and maybe taken at night works better than taking it in the morning. So these are very common concerns. I mean, you often, and prescribers generally know this, right? In terms of simplify as much as possible. And then sometimes people just need social help. They need help from like others, whether it's encouragement or whether they're living with other people that can play a role in supporting them. My wife reminds me constantly about taking meds. So sometimes there's others who can play an important role. The thing about I've thought about this approach to my work, and I found it to be very helpful. And I thought maybe it'll be helpful to you guys as well. To not, approach that really doesn't upset or irritate folks that we're working with. The first step, what I emphasize is our job is to understand the person's perspective, how they are experiencing and seeing the world, how they view their own challenges and mental health issues, how they see the role of medication in their lives, to really create a space where when people can really share how, what their emotional experience, beliefs, attitudes, values that are associated with the use of medication. And that's it. Before we advise, before we try to solve problems, is to really listen, active listening. The second is to sharing our point of view. So now we have an opportunity to say, okay, once the person feels like you're really listening to me, you've heard me, you've not judged me, then they're much more open to. So what is my therapist's point of view, or my counselor? What's their perspective on this? And then to find an opportunity to merge perspectives. And so that's an important piece. So let me just kind of just share a little bit with you on how I kind of see this. So the next slide. Yeah, then okay. So what I mean by understanding this person's perspective, here's some examples. If sharing with a person, look, what I get is you feel embarrassed about taking medication for your mental health. You feel anxious that other people will judge you negatively. Being seen as a normal person means like a lot to you. It's so confusing when you need to take 12 pills each day. You're frustrated and angry to be in this situation. You have mixed feelings about medication, etc. So these are just sort of examples. Or in your family or culture, having strange thoughts and feelings is not viewed as such a problem, but taking medication seems to be the absolute sign that you're mentally ill, and the shame that goes along with it. You want to avoid getting that label at all costs. So these are just examples of when we're empathically responding to some of the concerns folks may have. Let's go to the next slide. In step 2, sharing your perspective, to do it in a way that's not judgmental, this dismissive of the person communication, empathic regard, normalizing concerns, emphasizing areas of agreement. Scare tactics don't help. Close questioning, open-ended questions, right? Exploring the upside, the downside, sharing clear information about medication. The next slide. So these are just some examples of how you share your experience. John, would you like to know my thoughts about the role of medication? And if a person says yes, I say, I'd like to share my thoughts about your concerns that medication is causing more harm than good. From my experience and knowledge about you and medication, I'm concerned that some of the difficulties that disrupted your educational goals might get worse without medication. Does that make sense to you? So we do have a responsibility to share our perspective, and the person getting permission to share that perspective. And the person wants a trusting relationship. This is shared decision. It isn't like, well, you make the decision and I go along with it. It's shared. That's why I'm a helper, is that I have some knowledge, I have some experience and expertise, and I want to be able to share that with you. Many people I've worked with have very similar concerns that you have. It's only natural to think about the upside and downside of taking medication. It's an important decision. And I value the fact that you have felt comfortable raising your concerns with me. So these are just some examples of the person sharing their perspective. I'm sharing my perspective. And in the next slide, it's just the idea of merging our perspectives to see where we have areas of agreement and maybe some areas of disagreement, or we kind of have a different perspective on it. That's what a good relationship does, is that people can share some of their different perspectives where they line up and where they may not line up. Next slide. And then merging those perspectives. So John is an example. We seem to agree that medication ought to help you accomplish your goal of getting into community college. We both recognized, right, that taking medication you're currently taking makes you feel fuzzy at times, and we should figure out a way to reduce that side effect. I so appreciate that you might feel self-conscious about taking medication for managing sadness and lack of energy. Your concerns about others knowing you take medication for depression may change how they see you, and you're really concerned about that. So we both want medication to be helpful in accomplishing the goal. We seem to a little disagree about how fast to stop medication. How do you see it? Again, this is so respectful of the person, but at the same time, and from my perspective, we have a responsibility to share our point of view, but in a way that is not judging, is not trying to pressure, is not about control, but it's about that we both together come together to try to address this issue so that it helps you, whichever direction you go in accomplishing your goals. So I have learned this and approached this in a lot of my work, and I found it helpful. And perhaps you would find it helpful as well. And I think medication decision-making lends itself very nicely to this type of approach, and to be very patient with that first step, which is understanding the person's point of view. Next slide. how would you respond to someone who tells you that they haven't been taking their medication and don't plan to take it in the future? Okay. So let's see, any chat box. How would you respond to that? Person says, I don't plan to take it and don't plan to take it in the future. Any thoughts on how you might respond to someone? Okay, so use the LEAP method is basically, sort of like listening, engaging, agreeing, and planning, if I remember it correctly. But the idea here is, I think some of the things I'd share is that let's understand the reasons for it, right? Let me share my perspective. Let's try to merge perspectives. And the listening, very important piece of it, right? Acknowledge, ask them what they are concerned regards to medication. Exactly, really exploring that piece. Educate on the importance of considering alternatives. And maybe some of the alternatives, if you choose not to take medication, what that means is you may need to use other self-management strategies in order to address some of the issues that the medication was designed to address, whether it's some symptoms associated with sadness or anxiety. So, for instance, I don't want to take this stuff for anxiety or for my substance use. Then in a way, the burden, right? If once you understand the reasons and the person has come to that, it's an informed decision. They have the information that they need to have in order to decide on this. And then you're in a phase of, okay, so it sounds like medication is not part of the formula. Let's think about what kind of strategies you may need to use in order to manage some of the symptoms and difficulties that the medication was expected to address, but you want to address it in a different way. So that's where you might lead to, right? After you've done the listen, empathize, agree, partner with someone, how about lessening dosage a bit? Yeah, there are maybe some other things, or why don't we kind of like approach this and just reduce it slowly, right? So the person is kind of coming off of medication. And then how would we be very attentive to see whether or not it's working for you? So that's the other piece. How would we know that maybe if you decided to not take medication, that how would we know? What would be some of the signals or signs that perhaps medication may be more helpful than you believe it could be? So that's the other piece of it. Let's monitor things closely. Let me support you. Let's figure out strategies to manage some of the symptoms. That kind of approach, it keeps the person engaged. Next slide. So sort of, again, for clients who choose not to take it, you guys have come up with some of this: explore concerns, ambivalence. They have a right, stress that they owe it to themselves to make sure their decision is well thought out, balanced decision making. Let's really take a look at the pros and cons, of the decision. So if you decide not to, what might be some of the downside that we want to make sure that we attend to if there is a downside? And if medication is not part of your formula, what are the other things that we can do to help you manage some of the symptoms of concern? Okay, hope that makes sense to folks, that you don't feel like now you're in this tug of war or you're in argumentative therapy, but that you have kept the lines open and that you can help the person to think about, okay, I made this decision. Now let me explore other options, as Corley's just mentioned as well. Thank you. Next slide. Okay, so what I want to bring up now is, here is a tool. It's in the form of a brochure that I developed this trying to take into consideration all the information I've been sharing with you, that you can as a decision tool, so that, instead of trying to remember all these questions that I've been, that you may need to kind of consider, exploring the different factors, et cetera, even the, Dr. Salerno's not so famous kind of questionnaire, it's in here, right? There's 2 pages, and it includes these sections. What influences our decisions? This is for both you and the person you're working with, so that it's something you can give them and they can take with them. They could share it with family members. They could read it on their own. Okay. And so what influences our decisions about taking medication? Actually, in the very beginning, the first page would be on the right side, the safe and effective use of medication. Our program understands that. So this is a way, if you wanted to personalize it, um, this is an agency educational tool if you want. And you could put your own logo if you want, your own agency name. You can put contact information, whatever you want to do. But you could personalize this to your agency. And this could be something that's available to people. Well, it can be put in the waiting room. You can use it in your meeting with the client to say, we've been talking a lot about medication. I know there've been like a lot of issues. I just want to make sure that we really thoroughly thought through how, in what way might medication can be both safe and effective and help you to make progress in ways that you really want to make progress. So I have this, it's an educational tool. So it starts off with the safe and effective use of medication. Most people want answers to these questions. Why do I need medication? What's the upside, right? How do I use medication in a safe, effective way, an helpful way? These are important questions that we need to be able to answer for individuals. How to use medication in a safe and useful and effective way. What influences our decisions? And the next part of it is on the left side, you might see, what does making informed decisions about medication mean? And then why might a person not take medication? Let's go up further a little bit, Connor. And that's Dr. Salerno's not so famous list, attitude questionnaire related to it. So you'd ask somebody, gee, it's any of these things really relate to you? Do you feel the same way, that you don't understand or directly experience the benefit of medication? The side effects are too uncomfortable. Which one of these would you check off? And then it's also important to kind of like explore, like, do you even know why you're taking, what medication you're taking and why you're taking it, right? I mean, sometimes we might assume, but don't be shocked if you ask a person, what do you take? And say, I'm not sure. They just come about, I can't remember the name, right? What's the purpose for? I don't know. They just told me to take it. And then the other piece of it is upside and downside. That's decisional balance. If you have questions about the purpose and benefit of any medication, you might take a look. Let's take a look at, so what's the upside of it? What is it designed to be able to do? But what's the downside of it? And to be honestly able to have that conversation. So I put this together that I hope that it's a practical, useful tool that you could literally use. So easy to make copies of this. You just download it, make as many copies as you want. The agency may want to have it as like a educational brochure that's available to everybody. And you can use that in a much more structured, step-by-step way, rather than just having conversation about it. The other benefit is the person keeps it. The person takes it with them, rather than they have to kind of remember what we talked about. Instead of having to remember what we talked about, you have it here, you recorded it, and you take it with you. So any questions about this? Does this seem like something that could be practical and useful for you? What do you guys think? Okay, Carlos is saying, yeah, that I think this could be useful. Very much so, absolutely. Definitely. Great, great. I was hoping that you would find this useful and give it a try. And in one very little brochure, just you pack in a lot of information. And the most important thing is it's not just for you. You're not assessing the client and putting in your medical record. You're creating a resource that is helpful to the person you're working with. Okay. So I think that's about, I think we finished. I think we just about out of time. So here's the last question. Has this presentation increased your knowledge, skills, or confidence to work more effectively with clients to help them make informed decisions about medication? Just, if you guys could just finish this off. Yes, definitely. Yes, mostly, somewhat, not so much, or not at all. This will be our last poll. Just want to get a sense of. Terrific. Terrific. Thank you. So it seems like the majority is saying yes. I I can use some of this information and maybe the tool to be able to work more effectively with my clients. So mostly that's great. That's really very gratifying. For some, it's somewhat, and some folks are not really hitting where I would what I think would be helpful. But okay, so I'm glad that for most this seemed to be a helpful presentation, and I think we go to the next slide, and I think we just about ready to.
Yeah, I think we're about it. I mean, if there's any remaining questions, I think we've answered most that have come up throughout. If you have any remaining questions, please just you can put it in the chat box right now. We could probably answer one or two. As mentioned, the recording, the handout, and the slides will be posted on the ctacny.org website. Connor, if you can go to the next slide. We have a couple CTAC events. So if you're getting our emails, we also encourage you to join narrative enhancement and cognitive therapy. That's coming up on tomorrow. That's an evidence-based intervention to address self-stigma in adult populations. And we also have a person-centered planning webinar on Monday, which is also going to be really important and very much in line with some of the things we talked about today. If we can go to the next slide, there are, for those interested in CEs, the slides will have the instructions. We'll also follow up with an email once everything is posted that will also highlight where to access the recording and the handouts as well. And there is a feedback survey in the chat. If you can click that, let us know your thoughts about the presentation, as well as future offerings, that would be fantastic. So did we get any remaining questions? I don't see any.
I don't
Just
think
doing
so.
a quick scan. No. Okay. So just wanted to take the moment to thank you, Tony, for a wonderful presentation. Thank you everyone for joining us. We know you're very busy. We hope this was helpful, and we encourage you to access the resources and utilize that tool as much as possible. And you can use the feedback surveys to give us feedback on the handout as well, if there are some things that you didn't think was helpful, or some things you think could be updated. So thank you again, and have a great rest of the day.
Very good. Thank you.